Hi, welcome to our talk today. We're going to talk about breast cancer and how therapy can help after you've had your breast cancer treatments. My name is Amanda. I'm the occupational therapist and lymphedema therapist here at Cornerstone. So we have 4 topic areas today. We're going to talk about lymphedema, axillary porting, myofascial pain syndrome, and shoulder pain. So this first slide talks about your lymphatic system. It consists of some organs, vessels, and nodes that work with your venous system to return fluid back to your heart. It's an open system, so the fluid isn't pumped through by like a central pump like your venous system is. It has to do with your muscles and from the vibration of your veins moving through the blood. The purpose is to drain the substances and that cannot be reabsorbed by the venous system. It filters and cleans it and then brings it back into your heart. So why does breast cancer affect your lymphatic system? So after you're diagnosed with breast cancer, they take some nodes, test them to make sure the cancer hasn't spread into your lymphatic system. If those nodes are positive, then they have to take a couple more of your nodes, and they have to take enough to make sure that there isn't any cancer left in your nodes. If it's negative, then they don't take any more. So lymphedema, so what can go wrong? So they take those nodes out. It's kind of like closing down a couple toll booths on a highway. So you're driving along your highway and you come to the toll booths and all of a sudden 3 of them are closed. So you have to find a different route through. It's the same with your lymphatic system. So the fluid comes up and then those nodes are no longer there to filter and then move it back to your heart. So it has to find a different route. So the fluid starts to back up in your arm or in your breast tissue. So does early intervention make a difference? In short, the answer is yes. So the earlier you come in, the less likely you're going to have the stage 2 or stage 3 lymphedema, which is when it starts to become irreversible. It doesn't go back down to your normal size limb, whereas in stage 0 or stage 1, the lymphedema is easier to control. And there was a 5-year study of symptoms of people with breast cancer and lymphedema. And the outcomes were 30% that did not have early intervention went on to have stage 2, stage 3 lymphedema, whereas people who did, only 6% had stage 2 and stage 3 lymphedema. So how can you tell if you have it? The only really way to tell if you have it is if you come see a specialist. But some things that most people say is their arm feels heavy or it feels tight. You might notice if you wear a watch or ring on that side, it doesn't fit. You might have like lines that are indentations in your skin from wearing it, or your arm might become tingly. So how can therapy help? So in the clinic here, we do complete decongestive therapy, which consists of manual lymphatic drainage, which is a light touch massage that helps open up your lymphatic system and move the fluid out of the area congestion and then into your other arm. So if you had right breast cancer and your right arm is swollen, we would move the fluid over to your left side or from your right arm down to your left groin area or your right groin area. Bandaging, if it's stage 2, stage 3, and it's pretty severe, we would do some bandaging with short stretch bandages to help manage that. And once your numbers start to kind of maintain, then we would switch to phase 2. The important of the short stretch bandages is that it provides low pressure when you're just sitting around doing nothing, and then more higher pressure to help your body when your muscles contract against the bandages to help move that fluid out of that area. Skincare is important, so the low pH lotion if you have any wounds, some open areas to make sure you're not getting any infections, and then exercises to help move that fluid through as your body moves lymphatic fluid through your muscle pump. Phase 2 is more of a home management phase. So after we measure your arm or if it's your breast edema every week to see how it's going, and if your numbers kind of start to maintain, then we move to phase 2 and get you a compression garment. We set you up with a home exercise program. Make sure if you have any open areas or you know how to properly care for your skin in that area, because if you get a cut, then you're more highly likely to get an infection. And then your self-massage, or maybe we can get you a pump. Axillary porting often happens after you've had some lymph nodes removed. It's kind of like a sclerosing or fibrosing of the lymph vessel because it's stressed. It doesn't know where to go. Now you've taken away that pathway for it. It's completely normal. There's ways to treat it. The appearance of the cord might never go away, but we treat the more of the restriction in your movement. So again, it's a fibrous lymphatic vessel that's beneath your skin. It's usually right in your armpit area, but sometimes can be felt down into your thumb. So how do we treat that? We decrease the strain on your lymphatic system by doing your manual lymph drainage. We also can do some stretching and some myofascial release to help move that area around and help get your motion back so you're able to move more freely. So is shoulder pain after breast cancer treatment normal? The answer is no. There's a study that said that 43% of individuals that followed 5 years past breast cancer treatment, shoulders that have limitations in their motion because they did not have treatment to help reduce their pain and improve their motion, compared to the 9% that did have the intervention. So why is shoulder pain so common after your breast cancer surgery? So let the muscles around your shoulder tighten up to protect and guard the area that you had surgery on. And then some people tend to not move for a while, so it kind of gets stuck. And then you also have that scar tissue that prevents your normal movement of your arm. So how can therapy help with your pain or your mobility restrictions? So we would see what's going on. How far can you move your shoulder? Why is your shoulder not moving? Is it a scar? Is it a muscle? Is it just strength? Is it because your rounded shoulder, your posture, so if you have your shoulders rounded to protect this area, you're not going to be able to raise your arm all the way up. Myofascial pain syndrome. So nearly half of the women develop myofascial pain syndrome after surgery. So what is it? It's more like a trigger point, a tight band of tissue or muscle fibers that develop in your muscles that from the posturing you have. So there's a latent trigger point, which refers to just if you're touching it or you're activating it. And then there's the active trigger point where you have this pain all the time. So some common areas that are affected, there's a list of them here, but you might not always feel it where it is. So if you have this pain or this muscle knot that's kind of in the back of your shoulder, you might feel it back there, but you might feel it all the way down your arm or into your wrist as well. The same with this area here, because they've done surgery here. So things get tight, but you might not feel your pain here. You could feel it down in here. So, and then there's some other muscles that are often affected is your rhomboids, your serratus anterior, which is around here, and then your pec minor. So how is this treated? We then develop an individual treatment plan. Where are these trigger points at? What are they affecting? Are they all the time? Is it just when they're touched? And we address their factors. So your posture, your joint restrictions, there's a scar in the way, abnormal movement patterns, so maybe your scapula is not moving the right way with your shoulder motion. If you have a strength deficit or muscle length impairment, so from your surgery, is your pec now shortened? Is that causing the pain? So to recap, is pain or swelling inevitable and untreatable? The answer is no. We can treat all of this, and it's all very normal after your breast cancer surgeries. So to take home, why is early intervention so important? It's important to improve your mobility in your arm and decrease the economic burden of cancer survivors on you and the society. It decreases your likelihood of increase the stages of lymphedema. So stage 2 and stage 3, where it's harder to treat, your arm gets a little heavier, you might be more apt to have infections and do less. The cost of treating lymphedema, so an estimated cost to manage the early stage of breast cancer lymphedema is $636 per year, whereas if you have a late stage, stage 2, stage 3, it's up into $3,000. It's also important to have this early intervention to decrease your prevalence of pain from 43 to 9%. So you currently have 3 options to address your complications arising from the breast cancer treatment. You can come into our clinic. We are open and deemed essential by the Department of Homeland Security. We are doing extra cleaning, and then you're also treated in a private room away from everybody else. And we are wearing masks, the front desk staff, and I also have masks on. You can schedule a telehealth evaluation and follow-up. Not all insurances pay for an evaluation, so please call ahead to make sure that they run your insurance benefits and see if your insurance will cover that. You can start with what I've given you and then come in as you feel more comfortable. And you can leave your email address in the comments below or send it to elise@cornerstoneptnc.com. If you have any questions, feel free to type them in now, or you can email us at Cornerstone or Elise or myself at Amanda@cornerstoneptnc.com. Or you can call the number that's on the screen. Again, my name's Amanda. I'm the occupational therapist and lymphatic therapist here at Cornerstone.